Hiya, so I thought I'd do another vlog after my meeting with my oncologist, Dr. McCormack, and a young man that I've forgotten his name. But basically they gave me my treatment plan. They gave me an overwhelming amount of information, which I tried to scribble down at the time and make sense of later. So it's always good to take with you a pen and a paper, even if you're like a geek, to write everything down, because it just goes in and it gets overwhelming. So basically he told me that something I already knew, but which he reiterated, was that I have grade 2 invasive breast cancer. The grading is in terms of aggressiveness, so the tendency for it to spread, to get worse. So it's from 1 to 3, but he says he'd put money on it that it's probably grade 3, and that it was only grade 2 from the sample they took from the lump. So it probably is grade 3, as I'm young and cancer tends to be more aggressive in young women. So basically it's the full whammy of treatment. There's surgery, which is the lumpectomy or the mastectomy, and chemo, which is going to be 5 months worth, which is 6 separate doses of 2 different types of drugs. I'll tell you about that in a minute. Then there's, depending on whether my lymph nodes are involved or not, there is also radiotherapy, and then drugs afterwards, which is an extended course of drugs for 5 years when you're in remission. An interesting thing he told me is that my cells are estrogen receptive, which means that they react to the female hormone, which is quite odd for young women, but a positive thing, because it means they can treat the breast cancer with drugs as well, which gives me, you know, a higher chance of surviving, to put it morbidly. But if they do perform the small operation, which is the breast conserving operation, the lumpectomy, then they will have to do radiotherapy, so that's a downside. Whereas if you do mastectomy, there's still a chance I have to still do radiotherapy, but it's a smaller chance. So there's always a positive and negative of every decision. Same with my decision to start chemotherapy as my first treatment rather than surgery, because if I went straight into surgery, then I wouldn't be able to see whether the chemo was working or not, because the lump wouldn't be there. We won't be able to see whether it was shrinking or having any effect, etc. So I've decided to just go straight into chemo, get that out of the way, so to speak, and then surgery will be afterwards, and that just depends how well I get on with chemotherapy. So fingers crossed for me, I do really well and the lump shrinks right down and I'm not horribly ill for a long time. But you know, everyone reacts differently to chemo, so it's just try and error. I'm having my chemo done in London at, let me just find it, University College London Hospital, located near Euston. So it's going to be a bit of a trek, but it has a young person's cancer unit there, and I'm still considered to be a young person because it's up to 24 years old, so I have the support of younger people there. There won't probably be many people young with breast cancer. It will be other forms of cancer, but still it's all relative and it's a supportive community. So I just realised I look really cross-eyed in this video. Never mind. There's a lot of side effects from chemotherapy, I think, as everyone's well aware. Hair loss, heart problems, which isn't so good for me because my family has a long history of heart problems, but you know, there we go. Also aches and pains all over your body, almost like you've got the flu. That's quite common. Mouth ulcers, I don't like to say it, but oral thrush, that's one, which sounds like a ball. Your nails become super sensitive to sunlight, so you get to, well, you have to wear black nail varnish, which suits me because I like black nail varnish. to stop them dropping off. And then there's that horrible effect on fertility, because they want to get going with chemotherapy as soon as possible. We don't have time to stimulate the eggs, to save some eggs. So it really is a fingers crossed thing as well. Like, your periods stop through chemotherapy, or they're most likely to stop, or become irregular, reduced, you know, but then they're expected, especially the younger you are, to come back after chemotherapy, but there's no telling how long that will take. So let's just hope that I won't lose my fertility, because even though I've never been super, you know, crazy about having children, it would be horrible, to say the least, to have that choice taken away from me. But, you know, we have to be positive about these things. It's about saving my life first. The doctor said to me, make sure that you don't get pregnant when we're doing the chemotherapy, and I just had to laugh, because I was just like, well, there's no chance of that. I'm basically going to be a nun. But if you do become pregnant during the course of chemo, especially if it's the early doses, then it becomes very difficult to treat breast cancer. So it's very important not to get pregnant, people. I'm just trying to read from my notes here. Yesterday was my appointment with the oncologist. Today I'm going in to talk to Mr. Wood, who's the breast surgeon specialist guy who I go to. I'm not sure what it's about today. I might be having another ultrasound if he can fit me in today, but if not, then tomorrow I'm definitely going in for an ultrasound and some more needle tests on my lymph nodes. So I need to get more information about whether they're involved or not. But to my great relief, it's not the core biopsy, which was horrible, painful. It's just a regular needle. I can deal with that. And then next week I have another appointment on Wednesday with my oncologist. Lots and lots of appointments. I need a CT scan, which is a full body scan to make sure there's no cancer lurking elsewhere in my body. We would hope not. And then they hope to get going with chemo next Friday, which is terrifying, but I'm glad for the ball to be rolling so quickly now. So the next vlog I do will probably be in the chemo session, to show you how that works, and then I'll be reporting to tell you how I feel after these chemo sessions. Probably crappy, probably sick, but I'm still going to do the vlogs because I think it's important to show you everything of this experience, the highs and the lows. So yes, so tune in next time. Bye.